One of the most common stories I hear from military veterans goes something like this. My low back pain started during boot camp, PT, ruck marches, fireman carries, but didn't go to sick call. I just pushed through it. But now I've got this chronic low back pain and the VA is telling me it's not service connected. So in this video, I'm going to talk about why this is so common, why the lack of sick call doesn't just end your chances of ever getting service connected for it, and how a specialist could argue in a Nexus letter that it should be service connected. My name is Dr. David Geier, triple board certified orthopedic surgeon, sports medicine specialist, and anti-aging and regenerative medicine expert. I help military veterans by writing Nexus letters that argue that your orthopedic injuries are connected to your military training and service so you can get the compensation you deserve. And this is the latest in a series of videos I've been doing in which I answer service connection questions from military veterans. I get these questions all the time. And so I want to talk about this in the video. And it's a very simple question. How can I get service connected for back pain that started during boot camp, but I didn't go to sick call for it? We know that boot camp, and the military knows this as well, that the duties you do, the activities you do in boot camp just take a tremendous toll on your lower back. Repetitive heavy lifting, awkward postures, standing for long periods of time, ruck marches with heavy packs and equipment, push-ups on the ground, obstacle courses, just all sorts of stress on your lower back that causes micro trauma to the bones, discs, cartilage, ligaments in your back that over a long period of time can progress to degenerative changes that are essentially what you experience 5, 10, 15, 20 years from now. The problem is during boot camp, earlier in your military career, you don't go to sick call for it. You don't want to be seen as weak. You don't want to be put on profile. You don't want to let the rest of your team down. So you think, oh, I'll just rest between drills, take anti-inflammatory medications and hope it goes away. But just because you didn't go to sick call, or even just because you didn't have a specific injury, doesn't mean that there's not problem. Again, it's that micro trauma, that's micro damage that accumulates over time. And there are so many studies showing how low back pain is so common in military training due to that repetitive stress, the heavy loads that lead to issues many years down the road. Now, the VA, you're right, very often says, it's not documented. There's no service treatment records, but there is VA regulation that says that you don't absolutely have to have records of sick call visits to get service connected. You need 3 things: a current diagnosis, ideally some degenerative condition that can be argued developed over a period of time, degenerative disc disease, facet osteoarthritis, spinal stenosis, low back pain, lumbar strain, a little harder to argue, but specific diagnosis. An in-service event or stressor. It doesn't have to be a specific traumatic event. It can be physically demanding duties that you did in service, and then a nexus link, linking that stressor, either a specific event or a repetitive stress over time, to the current diagnosis. Lay statements like from your friends, family, showing that you were having pain during that period of time, people that knew you were having trouble, that can definitely help boost the argument. But then what's most important is the Nexus letter, something that ideally states at least as likely as not, or more likely than not, that your degenerative disc disease or facet osteoarthritis, spinal stenosis that's causing your chronic back pain is linked to service. You want a Nexus letter where the writer describes the stresses of the boot camp or physical activity, how those place stress on the lumbar spine, how they affect the discs and the ligaments and the cartilage and the bones of your lumbar spine, even without the traumatic event, to show that it progresses over a long period of time. Explain why it typically persists even without treatment, how service members very often self-manage and avoid going to sick call, citing studies that show that, which there are definitely, and also explaining how the symptoms of these problems very early on are minimal. They don't cause a lot of problems early on, but as those conditions progress over time, lead to things like chronic pain, stiffness of the lumbar spine or decreased motion, even radiculopathy, pain, numbness, tingling that radiates down one or both legs, and then ties it to your condition that you've got now. Looks at x-rays, looks at MRIs, discusses the degenerative disc disease, the facet osteoarthritis, the spinal stenosis, whether that's lateral recess or canal stenosis or neuroforaminal stenosis, how that potentially leads to a radiculopathy if you have that, but then explaining how the duties in boot camp, the activities that you did in boot camp can lead to those problems, can accelerate those problems far beyond normal aging or any factor that occurred after you left military service, jobs, things like that. That becomes very important. Yes, that Nexus letter incorporates any lay statements, buddy statements that you have as well, and even your description of kind of how all this went about to fill in the gaps, especially if it's 10, 15, 20 years between leaving military service and your first medical records for your lumbar spine. And then arguing the medical case, especially with scientific studies showing how the repeated loads, what we call axial loads, the compressive stresses on your spine can lead to trauma to the discs, ligaments, cartilage in your back, and ultimately to something like degenerative disc disease, facet osteoarthritis, spinal stenosis. And it's not just some vague opinion. In my experience, yes, it's caused by medical, shows the studies and an in-depth discussion of the medical argument, the basic science, the orthopedic science behind this condition. But it is absolutely something that can be argued successfully, and I can say that from many, many times doing it myself, writing these Nexus letters, can win service connection even without sick call letters. So get your medical records, write a strong buddy personal statement, get buddy statements or lay statements if that's necessary, and then look for a specialist in the spine in this case to help you with the Nexus letter to argue that was caused by your duties and activities in boot camp. Now, if you're interested in learning more about the disability claims process, I've written an ebook. You can get it completely free about the most common reasons the VA denies service connection and how you can potentially overcome those. Just click the link in the description below this video. Also, make sure to subscribe to this channel. Click the bell to be notified when I release a new video and when I start my Veteran Nexus Letter live streams once a month. Now, if you're already ready, you're interested in a Nexus letter or maybe a DBQ for your lumbar spine injury or whatever your injury or condition is, click the link in the description below that video, scroll past the ebook. You can learn more about working with me and my team. We try to make the process easy and quick, and I really try hard to write a researched, well-argued, persuasive Nexus letter that helps you win service connection. So definitely reach out to us. Thank you so much for watching, and I look forward to helping you.